Hi everyone, welcome back to my YouTube channel. This is Hatlade Oluwataiwo. I'm here with another educational videos. This is Kinesia with Ventures. Yeah, we do make educational videos to enlighten you and a lot of things that you have to know about your body, both in the physiotherapy aspect and also in the medical aspect if necessary. Alright, now we don't just do educational videos. The main thing we do home services, physiotherapy home services. We sell physiotherapy equipment, we sell medical equipment both in Lagos and outside Lagos within the country. If you are interested in doing any of these services that we render, you can hit me up on my YouTube channel. You can type your messages there and then I will get to you privately. Alright? And you can also reach me on my TikTok channel and browse Kinesia Fit Ventures also, and then I will respond to you there likewise. Alright, thank you for coming back here once again to learn with me. Today we are talking about cesarean section. I'm sure some of you, or maybe most of you, are really surprised as to what the cesarean section has to do with physiotherapy. It has to do a lot. Yeah, because just as medicine touches everywhere in the body, physiotherapy also touches everywhere in the body. We also treat conditions in regard to women's health. But before I dive into explaining these things, I want us to watch a video and then we'll snap back here shortly. I believe you've seen the video that you have watched and you have seen something very spectacular. You saw some of our the ones that we know, Kiki and the kitchen lover that cooks, okay, those ones. We see how they've gone through pregnancy and they've snapped back, right? Now, there's something that we need to know. We're not downplaying vaginal birth. Neither are we overplaying or praising cesarean section overhead. Okay, cesarean section happens to be something that had to come to play for the sake of women who couldn't, or who maybe just made the option because they don't want to go through the stress of pushing their baby through the vaginal canal. Alright, so it also saves the women's life, especially those who are already exhausted or they have narrow vaginal canal for the baby to pass through, or they have one complication or the other, another for their life to be saved, they have to undergo cesarean section. So what is this thing that we are calling cesarean section? For the likes of those who do not know, it is the long form of C-section that we always call all the time. You hear people saying C-section, 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 right? The full name is cesarean section. Say it with me, cesarean section. We are learning together, alright? Now, what is this cesarean section? It's the opening of the abdomen through cut with the knife, that is the surgical knife, to get to where the baby is and bring the baby out in order to save both the life of the mother and the child. Okay, and some even go for selection of it, maybe because as they do not want to stress themselves in going through through many hours of labor and then having to push the baby out. Let's move to it. The next thing. Physiotherapy plays a vital role in the recovery, the pain management, and the functional restoration. Why is that? Because by the time a cut has been made, an injury has been inflicted on the body part. So therefore, there will be weakness of the muscles of the abdominal region. What do I mean by abdominal region? The front part where everybody calls the stomach, which is not actually the stomach because the stomach is an organ that is located inside our abdominal region. Okay, so what all of us call as the stomach is the abdominal region. So when there is a cut on the lower part of the abdomen, right, is what we call C-section. We try to help the mother to manage pain. Yes, we also help them to restore back, to snap back to their original self. Okay, and then we help with functional restoration. That is, they are able to now go back and doing the basic functional things that they have to do as a woman, not that they are being, put in one space because of something that has happened. One funny thing we have to know about the cesarean section is that it's one of the very few surgeries that when it is done, under 24 hours after the surgery has been made, the mother has to be on her feet. And the reason is to avoid any form of clotting that will dislodge and cause problem later on. They want to make sure that there's also quick healing. Normally, when physiotherapists come in, they do not want you to delay and their complications now begin to set in. They want to make sure that you get back as fast as possible. And that's why you hear some physiotherapists saying no pain, no gain. Alright? There are some conditions that if you use that slang, no pain, no gain, it can cause problems. That one is not our business for today because what we are focusing on is cesarean section in order not to drag out the video for so long. Alright? Now, the next thing we need to know is what are the indications for C-section. So if maybe the baby is distressed and they want to make sure that the baby comes out okay, they quickly opt for cesarean section. Or maybe there's a prolonged labor and the mother is already getting stretched out, she's already gasping for breath and everything, they quickly go in for cesarean section. Multiple pregnancy like twins, triplets, that can actually put a lot of stress on the mother, and instead of her to just have to go through that stress, they just give her the options of cesarean section. I already said that, placenta previous C-section. Okay, then maternal condition, maybe the mother has hypertension and the like. And then I mentioned something which is very important. The pathway for the baby to come out being narrow can also lead to cesarean section. Okay, now what are the post-operative challenges? There could be pain at the cesarean, at the incision site. There could be reduced mobility due to the pain, of course, and risk of deep brain thrombosis, which is what I said. Because of this risk, you quickly make sure that the mother gets up as quickly as possible under 24 hours so that there will be no blood clot at any point in time that ends up causing a dislodge and going to either the heart or the brain, causing permanent damage that cannot be restored for a while. Then, or even at all self, which is very, very dangerous. Okay, then there's respiratory complication, there's weak abdominal muscle because there's been a cut in that place, and that's why physiotherapy step in order to strengthen those muscles as quickly as possible. Then pelvic floor dysfunction, there's postural issues because of the pain. They put themselves at the more comfortable posture they can be in order for that pain not to give them discomfort. Alright, then difficulty with breastfeeding positioning. The baby has to be in front, and it is even in the front that the cut has been done. So they'll be very uncomfortable because there will be pressure while they are holding the baby on the incision site. Now, what are the goals of physiotherapy? What we do is to reduce the pain, to improve the breathing and lung expansion. Usually, whenever surgery is being done, the lung capacities always tend to reduce because of exposure of the internal organs to the atmosphere. Okay, and even weakness of the muscles Also, remember there is an abdominal muscle that aids with breathing and is located up in this place which we call the diaphragm. Alright, so when there's an opening, there's generally a weakness to all the muscles because they are like intermittently linked to one another, and so it leads to the weakness of the abdominal muscles and then the pelvic floor muscles. Then promote independence. So we promote independence in their daily activities as fast as possible. How do we do that? The first thing is there's something that usually happens, and I think that's the first thing I even have to talk about before I now start talking about the management. And I want to be very fast about it. Okay, usually when I don't know if it is just me that it has occurred with, because whenever you go through any form of surgery, things that you do not have begins to worry you, like cough, like catarrh. Do you understand? That's the moment when they realize that, oh, I want to be present. And funny enough, it's always very difficult to cough and to even sneeze when you have a surgical site, in especially maybe your chest or your abdominal muscles, most especially your abdominal region. When there is an incision site there due to surgery and you have cough or catarrh, or it begins maybe when you have already woken up from the anesthesia and the like, whatever they're used to put you to sleep, there's always difficulty. So I'm going to teach you how to cough. Alright, how to cough. So now this is our bed. You are seated on either your chair or on your bed. It's even better when you want to cough, you are in a certain position so as to not choke on your saliva. Okay, so when that occurs, you get your pillow, right? Then you hold the pillow to your abdominal region, just as to support the abdominal muscle, because why, they've been weakened due to the incision site. Alright, so when you hold the pillow to that place, when you're about to cough, you try to breathe in to shift the oxygen to behind the irritation, whatever you that is there. So it shifts behind it and helps to push it out. Okay, so you are turning your head to the side, especially to the side where there's nobody there, so that you do not cough on the person. Okay, is in case if somebody is in front of you, so you have to learn the habit of turning your head away, in order for you not to cough on the person. Alright, so you hold to it and then you do that coughing. It helps a lot. In fact, 90%, or should I give you a big confidence? 100%. I will not tell you that there will be no pain, but the pain you will feel is minute compared to the pain you will feel without this. I'm telling you for a fact. Now that I've already taught us how to cough, the proper way to cough after your surgery, your C-section, okay, is your respiration exercises. It will help in building your lung capacity so as to not have breathing issue when you walk for a long period of time, or the normal period of time that you will walk. Alright, okay, so you learn the deep breathing. Okay, you can do that as many times as possible. It is always even advisable to do it as many times as possible. But usually we say that you do it at least 4 times. You breathe normal, like normal breathing. Okay. Okay. Now the next one that you now do is you breathe in, you hold it, you count 5, you breathe out. For me, because I want it to be stronger, I want the muscles to build stronger, I usually tell my patients to do 10 counts before they breathe out. But if they are not able to hold it for the 10 count, they can do 5 or 4. Okay, so you hold your belly, or you wrap your hand around it like this, and then you go. So because it is just the beginning of your recovery, I advise you do it 4 or you do 5 counts, alright? And then the repetition to be 4 times. So you do that 4 times, as I've already said. Okay, I did that twice in order not to waste our time, but you do that 4 times. Understood? You do that 4 times. Usually, it is advisable that you just do it like 5 times because you are just beginning your recovery process. Alright? And then that last one was the one that I thought of coughing, which is very, very important in order for you to get rid of whatever irritation or mucus that must have been stuck in the airway region. Yeah. So there is something we call incentive spirometry attached here. Okay. Incentive spirometry is not even expensive. You can get it from us for like 15k. It's not that expensive. Okay. Yeah. So it's not just for people with a cesarean section that can make use of it. Those who have breathing difficulty issues, or they have lung issues, or they've undergone surgeries also that has to do with their chest region, maybe the lungs, the heart, or what have you. Okay, so you can, whatever form of surgery that you've undergone, you have to do this breathing exercise. The next thing is circulatory exercises. As a lady, it doesn't even matter if you are aware if you are going to do the cesarean section or not. As a pregnant woman, before you go to the hospital, endeavor that you get the ankle pump socks. The ankle pump socks, or we call it TED talking. Alright, you can get it from us also. It's not really that expensive. Believe me, it's affordable for even somebody who is even earning maybe like 50k per month. Yes, it's affordable, very, very much affordable. Alright, so you can get it from us. What you need that test talking for is to endeavor that you are not having any issues with blood clot. Okay, yeah, you're not having an issue with blood clot. In fact, we have to learn the exercise ankle pump. Okay, so the exercise ankle pump will also help in pumping blood back to the chest, to the heart region. And the reason is because your leg is always, most of the time, the last part of the body that receives the blood. Every other part of the body receives the blood faster because why? They are closer to the heart region. But your leg is farther. And again, your movement and muscle contractions also while you move endeavors or aid the blood in coming back to the heart region. So you have to learn ankle pump exercise. So when you have done your cesarean section or you have not given birth, you have to do the ankle pump. So how is it done? Just follow my hand. Like I said, my hand is my leg. Okay, so imagine this is the part of my leg that is on the floor, right? And this is my leg where I have my tibia and fibula. All right, so now I move up, down, up, down, up, down, up, down. In the process of it doing that, you are also aiding pumping of the blood. So the deoxygenated blood goes back up, and then the oxygenated blood comes down to give good blood supply to the legs, so there will be no issue. So, but make sure that you have that test talking because it will help a lot as a woman before you go to the hospital. You, even though you know you are doing the cesarean section or you do not know, it's very important for you. All right, you have to know the ankle pump. so as to prevent that deep vein thrombosis, which I've already explained to us already earlier on. Now, early mobilization within 24 hours after the surgery, we always encourage that you are already up on your feet. So the nurses will aid you in standing up, okay? But you have to stand up carefully. So when you are standing up, endeavor that you move to either side of your body with support of the pillow so as to not stress yourself. So you place the pillow on your stomach, your abdominal region, and then you begin to shift little by little to your side. So when you are on your side, you bring out your leg from the bed, okay? And then you use the upper hand, the hand that is facing up. You place it on the bed and use it to push yourself up. Don't push yourself up with your body. Rather, push yourself up with the upper hand, the hand that is facing up, that is not lying on the bed. You place it on the bed and then you raise yourself up. Okay? And then when you do that, you gradually bring yourself to a standing position. The nurses will be there side by side to help you as you walk. It will be difficult for you to stand straight because a surgery has been done. In fact, we even feel extremely heavy there. Okay, so you can assist yourself in holding. You don't need to put too much pressure there. Yes, just hold and straighten your body at least as much as possible. Don't despite the fact that you're having the pain. I will not lie for you. I will not lie for you at that one. But I'm telling you from what I've heard, what I have seen, okay? And of course, for those of us, or for those of us who are even planning on having our children in the nearest future, all these things are necessary for us to know so that we'll be able to help ourselves at that point in time. So it is not just those who are pregnant that have to watch this video, also those who have given birth, those who are sent to every single person. In fact, the husbands even need to know, the men need to know, because you will be a support system to your wife, okay? And so if you have this knowledge, you have this understanding, you will be able to guide them through it all without any form of complication or difficulty at all right? So that's one thing. Then the next thing is abdominal strength, teaching abdominal breathing. Okay, I've already taught that. And then there's also an exercise that we also teach, that is Kegel's exercise. It helps in strengthening the abdominal muscles. So what you are basically doing, you can do it in any posture you find yourself, be it on the bed, be it when you are standing. So basically what you are doing is you are squeezing your buttocks and you are holding it, because at the end of the day you are also strengthening your pelvic floor muscles. That is one of the major reasons why Kegel's exercise is important. We don't just teach it for those who have done cesarean section, we also teach it for those who have done vaginal birth also, right? And those who have maybe prolapse or what have you, yes, in order to strengthen their pelvic floor muscles. So Kegel's exercise is for that. So you squeeze your buttocks in like as if you are trying to endeavor that you don't pull on yourself. For instance, you are having the pressure to go use the toilet. That is do number 2. That is pull, okay? And you do not want to pull on yourself, and so you clutch your buttocks, right? At that moment, you are breathing. One thing I've realized is that whenever we are teaching patients this particular exercise, they usually hold their breath. So physiotherapists are always on the look for that you do not hold your breath. Rather, you breathe normally and just make sure that you are clenching your buttocks, okay? And then you count 10, you relax. You do it up to like 5 times. You count 10, you relax. When you are counting, let there be rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do not count fast, because why? It has to follow a pattern. Okay, when you are counting, you must follow a pattern. It helps a lot, because when you are counting, let's say for instance, let me give you an instance. 1, 2, 3, 4, 5, and I reach 10, and then I go 1, 2, 3, 4, 5, and I reach 10, and I go 1, 2, 3. There is no consistency, so there has to be consistency for us to see improvement. Okay, yes, so that's what is important. Then the next thing is we teach you positioning when you want to breastfeed your child. and even sitting. So you put a pillow at your back, okay? You put a pillow in between your arms. Just put your arm as 90 degree. You know, there's even a pillow, a round pillow that it goes round like this. I'm sure all of you knows it, right? Good. You can even get it from us. It goes round like this, okay? You place it round yourself. The pillow is already supporting you at the back, okay? And then you put your child there and you place your hand. Let your hand be straight. Let me bring this camera down so we can see what I am doing. Okay, yeah. So my hand is at a resting posture, 90 degrees, so that when you are carrying the child, it's not putting too much pressure. You're not putting too much pressure on yourself, thereby causing pain in your arm. Okay, so that's why the pillow is necessary, so that you don't feel pain over time. Okay, even though you know that the child is very light, carrying even as little weight as possible for a long time can put a strain on the arm. So that's why there is that resting pillow. Okay, so when you want to sit down, sit and let your back be straight. Do not slouch, because it's going to be affecting your back a lot. Yes. Now that bouncing ball, I will show you because I have one. This ball. You know that when you were pregnant, right? You use this ball to do some exercises. You still need it a lot. Yes. So there are some exercises that you can help yourself with. And please, let me tell you something that is very important. If you are tired at any point, do not stress yourself. Stop the exercise and relax. It's very important. We always look out for that. We do not like to put any of our patients under stress at any point in time, because why? It can cause any form of slight discomfort and even worst scenario, complication. So we always encourage and advise that you relax when you are tired, even though you are not even done with the repetitions or the intensity or what have you that you have been told to do. Please relax. So now, this ball, you will still need it. So what are you going to be doing with it? Don't worry if you are not seeing the whole ball. Okay, up, down, up, down, up, down. So your arms straight, your legs standing straight. Sincerely speaking, these exercises are very, very important. Okay, so you stand with both legs apart a little bit. Okay, it's just like the way you do the exercises of when you are carrying weight in your back or in your hand. Those people that used to carry weight with their hands, you know what I'm talking about. So you stand at that position, you hold the ball forward, okay, and then you bring yourself up, you take yourself down. Bring yourself up, you take yourself down. So that's the way you do this exercise. You can go 10 count, up, down, 1, up, down, 2, up, down, 3. Make sure there is consistency and there is rhythm in your counting. Don't go fast and then the next 10 you go slow, and then the next 10 there's even no consistency in the way you are counting it. That is not how to do it. It's for your benefit. That's the reason why I said just let there be consistency in the way you do your counting. Okay, now the next thing we need to know, please avoid heavy lifted onto your lung. You are not superwoman, even though you are superwoman. We do not say we need a Supergirl, or which other cartoon character do we have now that does heavy lifting. Please do not risk it, because why? If you do that, please let me just tell you now, that cesarean section can reopen itself again. Am I scaring you? Not scaring you. I'm telling you the truth so that you don't do it. Prevention is better than what? Cure. It can reopen again. So please do not do any form of heavy lifting. If there's any form of heavy lifting you need to do, let your husband do that. Okay? Now avoid intense abdominal exercises. Monitor your wound healing. As I already said, if there's pain, there's dizziness, you are tired, you are bleeding, please stop. And if there is no progress in getting better after you stop, please make sure that you report back to your doctor immediately. Okay, so now endeavor that you are also taking a lot of water, you are taking enough fruit, you are taking whatever medication that has been given to you, okay, and you don't stress yourself as much as possible. Please don't. Endeavor you have support system. Let your parents be there, your mom or your husband's mom or your siblings, whatever you know. And please, for those of you who go to greet those who have given birth, give them as much support as possible. Because if I want to do it, I will give them the right to carry koboko and be flogging you if you go to their house and you are ordering them up and down, especially those who have undergone cesarean section. You've not undergone surgery, you are sending them on for what? So let me be angry, please. It's not easy, long. It's not easy. Even vaginal births, don't stress them, ejo. So now I've come to the end of my video. The reason is just so that we are well educated. That's the reason why I did it to be this lengthy. But I know that yes, everything that I've said is very, very important, and that is why you have to watch to the end of the video in order for you to get every single information that is needed and is necessary for you to hear. Yes, share with everybody, both male and female. The reason why male has to know is so that they prepare themselves. There are even some of you who are ready to be fathers, so you have to know these things so that you can help your wife who will become a mother soon, and you have no idea if it is going to be through cesarean section or through vaginal birth. Either one is not easy, so you help them. Because this month happened to be cesarean section awareness month, I want to say a big congratulations to those of you who have undergone this surgery. I want to say you people are really the real MVPs. You tried. It's not easy. It's not. And for those of you who also went through vaginal birth, it is not easy for you to even hold yourself to do that. I pray for everyone, every single mother in this place, and those who are going to be mothers to be in the future, that the Lord will grant you the strength to be able to deliver your children safely, and no evil shall befall neither you or your child or your children. The Lord will keep all of you safely in the name of Jesus. We will not hear any bad story or any bad news from any of you in the name of Jesus. Thank you for having me and sticking to the end of my lengthy video. I want to say bye. Actually, we will do some more educational videos. Believe me, they might be lengthy because why? I want to make sure that we have every single information and details that are needed for us to know. Okay, thank you and have a good day. Bye.